On this video, we're going to be reading an article comparing COVID-19, the coronavirus disease 2019, with the flu. This is from John Hopkins Medicine, which is a prestigious university. All right. Influenza, the flu, and COVID-19, the illness caused by coronavirus that's led the current pandemic, are both infectious respiratory illnesses. Although the symptoms of COVID-19 and the flu can look similar, the two illnesses are caused by different viruses. Lisa Marigadis, MD, MPH, Senior Director of Infection Preventions at John Hopkins, explains how the flu and COVID-19 are similar and how they are different. So first, we'll talk about the similarities between COVID-19 and the flu. So similarities in symptoms, or how you express that you have this disease. Both cause fever, cough, body aches, and fatigue, sometimes vomiting and diarrhea. The full list of symptoms of COVID-19 continues to evolve as more is learned about the illness. Can be mild or severe, even fatal in cases, can result in pneumonia. Transmission, how is the transmission of these two similar? Both can be spread from person to person through droplets in the air from an infected person coughing, sneezing, or talking. A possible difference, COVID-19 may be spread through the airborne route. We'll see that more in the differences below. And both can be spread as by an infected person for several days before their symptoms appear. So you may be asymptomatic, but can still infect people and transmit the disease. So let's look at treatment. How are these two similar as far as treating these viruses? Neither virus is treatable with antibiotics, which only work on bacterial infections, and both are treated by addressing symptoms, such as reducing fever. Severe cases may require hospitalization and support, such as mechanical ventilation. Prevention. Both may be prevented by frequent, thorough hand washing, coughing into the crook of your elbow, staying at home when sick, and limiting contact with people who are infected. Social and physical distancing can limit the spread of COVID-19 in communities. So those are some similarities. Let's look at some differences between COVID-19 and the flu. So how are their causes different? COVID-19, caused by one virus, the novel 2019 coronavirus, now called severe acute respiratory syndrome coronavirus 2, or SARS-CoV-2. Flu is caused by several different types and strains of the influenza virus. So we're going to go through many influenza viruses every year, and they all cause what we call the flu. Transmission, how is their transmission different? While both the flu and COVID-19 may be transmitted in similar ways, there is also a possible difference. COVID-19 might be spread through the airborne route, which means that tiny droplets remaining in the air could cause disease in others, even after the ill person is no longer near. So basically, if I'm in a room, I'm living and breathing in this room, I leave, somebody else comes in. With COVID-19, there's a possibility that they could contract the disease just from my particles still being in the air. Antiviral medications. So how are these different? COVID-19, antiviral medications and other therapies are currently being tested to see if they can address the symptoms. Antiviral medications for the flu can address symptoms and sometimes shorten the duration of the illness. We already have some antiviral medications for the flu, but not for COVID-19. Vaccines, how are the vaccines different? COVID-19, no vaccine is available at this time, though development and testing is in progress. The flu, a vaccine is available and effective to prevent some of the most dangerous types, to reduce the severity of the flu. How are these different? COVID-19, the first case appeared in China late 2019. The first confirmed case in the United States appeared in January 2020. Approximately 3,369,519 cases have been confirmed worldwide, and there have been 1,107,815 cases in the U.S. as of May 2, 2020. The flu, the World Health Organization estimates that 1 billion people worldwide get the flu every year. In the US, from October 1, 2019 to April 4, 2020, the CDC estimates that there were 39 million to 56 million cases of the flu. The CDC does not know the exact number because the flu is not a reportable disease in most parts of the US. So numbers for the flu seem to be higher, but COVID-19 is still developing. Deaths. COVID-19, there have been approximately 24,654 deaths reported worldwide, and in the US, 65,298 people have died from COVID-19 as of May 2, 2020. Flu, the World Health Organization estimates that 290,000 to 650,000 people die of flu-related causes every year worldwide. In the US, from October 1, 2019 to April 4, 2020, the CDC estimates that 24,000 to 62 have died from the flu. The CDC does not know the exact number because flu is not a reportable disease in most parts of the US. The COVID-19 situation is changing rapidly. Since this disease is caused by a new virus, people do not have immunity to it, and a vaccine may be many months away. Doctors and scientists are working to estimate the mortality rate of COVID-19, but at present it is thought to be substantially higher than that of most strains of flu. So essentially, the mortality rate or the death rate for COVID-19 is estimated to be higher, but right now we don't have as many deaths as most flu seasons. Something to keep in mind that this article did not mention was the fact that this is most relevant for the elderly and those who have autoimmune disease or their immune system is compromised in some way. So keep that in mind as you read these facts, and make sure to check the quiz link in the description below. Fill that out. I've also linked the article in the description so you can look at that on your own. And again, if you have any questions, feel free to reach out. Also, shout out to Daniel Castrojohn, who has been doing every single quiz. Super proud of you, man. And also, he's starting a YouTube channel. So make sure you check out his YouTube channel. I'll link that as well in the description. And give him a like and a subscribe. So appreciate it, Daniel. All right, that's it for me. Hope you learned some difference in the flu and COVID-19 in this article. And miss you guys.